The fluorescent lights hummed like a swarm of insects trapped in plastic. Natalie Hayes didn't notice them anymore. She'd stopped noticing a lot of things: the way other nurses scattered when she entered the break room, the way Dr. Pierce's eyes tracked her movements through the ICU like she was a problem waiting to be solved, the way her hands had learned to stay perfectly still even when everything inside her wanted to move. Hands that had held lives together in ways this hospital would never understand. St. Michael's Hospital in Norfolk breathed around her in a rhythm she could navigate blind. Ventilator whoosh. Monitor beep. For pump clicking its metronome. She moved through the ICU at 0630 hours like she was running a perimeter check, her eyes cataloging every detail: patient positions, medication drip rates, the slight elevation of a central line that shouldn't be there. 12 years of training didn't disappear just because you stopped wearing the uniform. It just went quiet. Dormant. Waiting. The ICU nurses' station occupied the center of the unit like a command post. Natalie sat at the far end, her posture upright but not rigid, her fingers moving across the keyboard with the same precision she'd once used to disassemble a rifle in under 4 minutes. Her handwriting in the patient charts was meticulous, every abbreviation correct, every vital sign legible. Documentation was armor. Documentation was proof. The other nurses clustered around the coffee station 3 feet away, their voices rising and falling in the particular cadence of people who'd worked together long enough to finish each other's sentences. They didn't finish Natalie's sentences. They didn't start them, either. She ate lunch from the cracked mug that read *World's Best Nurse* in faded letters, which had been given to her by someone whose name she couldn't speak anymore. Turkey sandwich. Black coffee. Nothing else. The same meal, same time, same corner of the break room when she absolutely had to be there. When she entered, the other nurses would gather their containers and drift away like leaves in wind. Natalie never acknowledged it. Acknowledgement required emotion. Emotion was a liability. She'd learned that in Bagram, where 1 second of hesitation meant someone didn't come home. Some lessons didn't fade. She wore long sleeves even in summer. The tattoos underneath, operational dates, call signs, coordinates of 5 base locations that had been erased from every official record, needed to stay hidden. The real evidence, though, was sewn into the lining of her jacket, the one she kept in her locker, a faded unit patch, barely bigger than a postage stamp, its edges worn from being touched too many times. During breaks, when she was alone in the supply closet or the stairwell, her fingers would find it through the fabric and press against it for exactly 10 seconds. Long enough to remember. Short enough that nobody could call it a breakdown. Room 347 sat at the far end of the west corridor. The Navy SEAL inside had been admitted 4 days ago with a training accident, something about a helicopter insertion gone wrong, the details vague in the way military injuries always were when they involved classified operations. He was recovering well. Good lung function. Clean X-rays. The kind of patient who should have transferred out already, except his traumatic brain injury had left him with severe memory deficits, and they were monitoring him until neurology gave clearance. Natalie checked his vitals every 4 hours, blood pressure, pulse, oxygen saturation, the steady climb of consciousness returning to someone who'd lost pieces of himself. His left forearm lay across the blanket, visible. Tattooed down the inner skin in block letters, *N Hayes star. She'd seen it on her first shift in this room. Her hands hadn't trembled then either. She'd simply taken his wrist, checked his radial pulse, and continued her assessment. When he looked at her, his eyes held nothing. No recognition. No memory of the night in Sanjin Valley when she dragged him across 200 meters of kill zone while RPG rounds tore into the compound behind them, when she'd applied a tourniquet with one hand and radioed for dust off with the other, when she'd screamed commands at him even though he was already gone somewhere inside his own head. The traumatic brain injury had stolen that night completely. He looked through her like a stranger. He was, now. They both were. Dr. Pierce materialized at the supply desk around 08 for 5 hours, his white coat impeccable, his stethoscope draped across his shoulders like a symbol of authority that he never actually put around his neck. He didn't examine patients himself anymore. He ordered things. Others complied. Natalie was reviewing the cardiac equipment invoices, a routine task, something she'd been doing every Tuesday for 2 years, when she noticed the discrepancy. The same portable defibrillator appeared on 3 different patient bills, same serial number, same unit cost of $847 per day. 3 patients. Same equipment. Impossible. She pulled up the equipment logs, cross-referenced with the supply room database, traced the paper trail backward until the pattern emerged like a scar under pressure. The same device billed 3 times over. The supply company's name at the top of each invoice, Cardiotech Solutions. The company that Dr. Pierce had listed as a consulting relationship on his hospital credential file, though nothing about him consulting had ever appeared in the committee minutes she'd seen when she pulled the ICU meeting records 6 months ago. Dr. Pierce. Her voice was low. Respectful. The voice of someone who knew her place. Can you review these invoices with me? She printed them out and extended the papers. His eyes moved across them, and something shifted in his posture, a tightening around the shoulders, a subtle change in the blood flow to his face. He'd understand immediately what she'd found. Not because he was brilliant, but because he already knew it was there. These appear to show the same defibrillator unit billed 3 times, Natalie continued in that careful voice. Different patient rooms, but matching serial numbers. I wanted to flag it before we process payment to Cardiotech. The silence lasted exactly 3 seconds. Then Dr. Pierce's expression rearranged itself into something professional, something practiced. The billing system sometimes generates duplicate reports when equipment is moved between units. It's a known issue. Finance handles the reconciliation. You don't need to worry about it. It wasn't a request. It was a command. The kind of command that people obeyed because disobeying meant friction, meant questions, meant becoming someone worth pushing out. Natalie took the papers back. Of course. I'll let billing know. She wouldn't. She'd already seen the billing department's notes from 2 months ago, no equipment transfers logged for that serial number. No movement. No reconciliation. Just 3 separate charges, 3 separate patient rooms, 3 separate profits for Cardiotech Solutions, which Dr. Pierce consulted for. Which meant he was getting paid twice, once by St. Michael's as a physician, once by Cardiotech for steering business their way. He walked away. She returned to the nurse's station. The documentation continued. The clock continued. Nothing changed in her posture or her breathing. The trembling that wanted to happen, the anger that wanted to speak, stayed locked behind her ribs like a weapon in a vault. She'd learned restraint in places where showing emotion got people killed. Around 1,100 hours, a patient in room 342 began to deteriorate. 78-year-old woman, admitted with acute heart failure, scheduled for a consultation with cardiology that afternoon. Her oxygen saturation was dropping, sat 91 and falling. Her breathing had shifted into the shallow, rapid rhythm of someone in distress. Natalie was there first, applying supplemental oxygen through a non-rebreather mask, checking the fall line, reviewing the most recent labs on the bedside computer. The EKG from 90 minutes ago showed nothing critical. Just sinus rhythm. Normal, textbook sinus rhythm. Except this patient's heart wasn't normal. And the rhythm wasn't matching the clinical picture. Dr. Pierce arrived because Natalie had paged him. He entered the room, glanced at the monitor for 4 seconds, and said, "Anxiety. She's panicking. Give her 2 milligrams midazolam 4. She needs to calm down. Anxiety." The word hung in the air like a diagnosis, neat and efficient and absolutely wrong. Natalie looked at the patient's face, that particular shade of grayish-blue around the lips, the way her hands were gripping the bed rails, the way her eyes held the specific kind of panic that came from not being able to breathe. That wasn't anxiety. That was a body in crisis. "Doctor, her O2 sat is 88 now. I think we need a 12-lead EKG and a troponin check. She might be having an MI." Pierce didn't look at her. The EKG was normal 90 minutes ago. We're not running labs on every patient who gets anxious. Give her the midazolam. It wasn't a request. Natalie had learned the difference between requests and commands a long time ago. Commands came with the weight of authority behind them. Commands were what you obeyed in a combat zone because lives depended on chain of command. But she'd also learned, in those same zones, when to listen to the body in front of her instead of the rank trying to order her around. She administered the midazolam, protocol was protocol, and she wouldn't be the one refusing orders on the record. But while Pierce stepped out of the room, she ran the 12-lead EKG anyway, her fingers steady on the electrode pads. ST elevation in leads 2, 3, AVF. Her jaw tightened. Inferior wall MI. The kind that could become catastrophic in 4 minutes. She called the ER. She called radiology for a stat echocardiogram. She called the charge nurse and said her voice was level, her words precise, "I need Dr. Castellano from cardiology in room 342 immediately. Inferior wall myocardial infarction, EKG confirmed." Dr. Pierce found out because the paging system announced it. He appeared in the doorway as Dr. Castellano was reviewing the EKG, as the ER was preparing for a stat cath lab, as the patient's color was already improving because now she was getting what she actually needed. Pierce's eyes locked on Natalie and something in them went sharp and predatory. Later, he called her into room 342 in front of the patient's daughter and her son-in-law. He waited until they were all present, witnesses, which was the mark of someone planning something official. "Ms. Hayes, you overstepped your scope of practice by ordering diagnostic tests without physician authorization. You administered medication, you made clinical decisions that belonged to the medical team, and you," his voice dropped into something colder, "you directly undermined my assessment in front of patients. That's not only inappropriate. It's dangerous." The daughter was watching, her eyes moving between Natalie and Pierce. The son-in-law had his arm around her shoulders. Natalie's hands didn't shake. Her voice didn't waver. "I was concerned about her clinical presentation. Your job is to be a nurse. Not a physician. Not a diagnostician. Just a nurse. Do you understand the difference? Just a nurse." The words landed like they were supposed to land, like she was small, like she was presumptuous, like she'd overreached beyond what someone like her should attempt. The daughter and son-in-law were already pulling away, already shifting their trust back toward the doctor in the white coat, the one with the authority and the credentials and the certainty that came from having never been wrong. Or at least, having never been caught. "I understand," Natalie said. By 1400 hours, there was a formal write-up on the ICU unit board. Written documentation. Official record. Natalie read it while standing at the nurse's station: inappropriate medication administration, unauthorized diagnostic ordering, scope of practice violation, conduct unbecoming. The paper was initialed by Pierce and copied to the nurse manager and filed in her personnel record. She read it once and then didn't look at it again. The words would stay, though. They always did. She'd learned that in Bagram too, the way accusations stuck even when they were false, the way one person's authority could reshape reality for everyone who wasn't in the room when the actual events happened. The unit went quiet around her in a way it hadn't before. The other nurses still didn't talk to her, but now there was something else underneath it. An awareness. A distance. News traveled. Pierce had worked the unit long enough to have credibility. Whatever he said about her, people would believe. That was how authority worked. That was why it was dangerous in the wrong hands. But that wasn't the worst part. By evening, the patient in room 342 was stable in the cardiac care unit. Her troponin levels confirmed the MI. The early intervention had prevented a major cardiac event. She was going to recover. In 6 months, she'd probably write a thank you card to the nursing staff who'd caught what her physician had missed. The card would go into a drawer. Nothing would change. In room 347, the Navy SEAL slept with his left arm visible, the tattoo dark against his skin. *N Hayes star. If he ever remembered who'd put her name on his body, he'd never be able to tell anyone. The memory was gone. The classified operation was erased. Captain Natalie Hayes had been ordered to disappear into civilian life, to keep her head down, to never acknowledge what she'd been or what she'd done. Just a nurse. That's what she was supposed to be now. Just a quiet nurse in Norfolk who kept her head down and didn't question things. Except she'd already questioned things. And now someone was making sure everyone knew she shouldn't have. The break room door swung open and Natalie set her lunch container on the corner table, the one no one fought over, the one that faced the wall. She sat down with her back straight, opened the lid, grilled chicken, brown rice, steamed broccoli, and took a measured bite. The room smelled like microwaved popcorn and burnt coffee. Around her, 7 nurses occupied the other tables, their voices carrying the easy rhythm of people who belonged. She chewed. Swallowed. Took another bite. Then something shifted. A nurse at the center table, Rodriguez, someone she'd worked alongside for 3 weeks, stood abruptly, gathering her lunch bag. Then Chen. Then the 2 residents from pediatrics. They moved like a coordinated unit, their movements too synchronized to be accidental, and they filed past her table without a glance, their eyes fixed on some invisible point beyond her shoulders. One of them muttered something about the medication cart needing restocking. The words weren't meant for her. The room's temperature seemed to drop 10 degrees. Natalie continued eating. Her jaw worked the same rhythm. Chicken, rice, broccoli. Mechanical. Empty of thought. She did not watch them leave. She did not acknowledge the message being delivered with the precision of a military maneuver. Her hand sat flat on the table, visible, steady, and in the fluorescent light streaming through the break room window, she was utterly, completely alone. The silence was the kind that lived in operating theaters when the patient coded. The kind where you could hear the refrigerator humming behind the microwave, the distant beep of a monitor from the unit beyond, the whisper of her own breathing. She finished her meal in that silence, closed the container, and stood to place it in her locker. No one returned. No one would, she understood now. Not while she was still here. The write-up appeared on the unit board the next morning at 0640 hours, posted on the public display where every staff member and visiting family member could see it. White paper, official hospital letterhead, printed in the cold language of institutional protocol. Asterisk disciplinary action, Nurse N. Hayes, medication documentation error, failure to chart medications within required time frame, scope of practice violation. Asterisk below it, witness statements from 3 nurses. Rodriguez. Chen. A third name she didn't recognize, a nurse who worked the opposite shift, who had no possible way to witness anything. The statements described her behavior as dismissive, argumentative, resistant to supervision. Natalie read it once. Her breathing stayed level. Her hands didn't shake as she removed the paper and placed it on her supervisor's desk, pointing to the third witness name, someone who hadn't worked the night shift she was supposedly cited for. She said nothing. Her supervisor, Margaret, who'd trained her 3 weeks ago, wouldn't meet her eyes. Dr. Pierce submitted this through proper channels. Natalie. I'm sure there's been some confusion. The way she said it, the apology in her voice, made clear that Margaret believed none of it and would defend none of it. What happened next didn't just silence the room, it began a systematic dismantling that moved with the precision of someone who knew exactly how to dismantle a person. Pierce reassigned her. First to the least critical patients, post-op recoveries, routine discharges, the admissions that any competent nurse could manage in her sleep. Then he restricted her access to the controlled medication dispensary, claiming a documentation concern, requiring a second verification from a staff pharmacist before she could pull anything. Then he began documenting minor infractions that hadn't existed the week before. A vital sign charted at 1407 instead of 1405. A patient's breakfast preference documented under the wrong field. A bed adjusted without calling for assistance. Each write-up was sealed in a folder with her name on it. Each one included witness statements from staff members who suddenly had very specific recollections of events they hadn't witnessed. Dr. Pierce moved through the unit during afternoon rounds, his white coat crisp as new bills, his stethoscope draped around his neck like a general's insignia. He didn't address her directly anymore. He spoke about her, to other people, in her presence. Ghost really should watch her documentation, he said to a resident outside room 291, loudly enough for the hallway to hear. Some nurses just don't have the attention to detail for acute care. Might be better suited to something less demanding. The resident glanced at Natalie. She was charting vitals at the station. Her pen moved in steady script. She didn't look up. The medication cart incident came on a Wednesday at 1,420 hours. She needed a 0.5 mg dose of atropine for a patient showing signs of bradycardia. The pharmacist looked at her request, then looked at her, then looked at the request again. Dr. Pierce said you might need assistance with dosing calculations. Let me verify this one. The dose was standard. The calculation was first-week nursing school material. But the message was clear. She was no longer trusted. She was no longer competent. She was a problem with a name and a job number that Pierce was slowly erasing. By Friday, she'd been documented 4 times. By the following Wednesday, 7. Each violation real enough that it couldn't be challenged, small enough that it couldn't be defended without sounding defensive. Each one added to the file like evidence assembled by someone patient and methodical and absolutely certain he would win. The other nurses had stopped making eye contact. Some of them looked guilty when they passed her. Others simply looked away, the way you'd look away from someone who might be contagious. She was being treated like a diagnosis no one wanted to catch. In the break room, she no longer tried to sit with them. She took her lunch to the supply closet, a narrow space between shelves of sterile gauze and 4 bags and trauma shears, and sat on a low stool with her container balanced on her knees. It was there, during an afternoon break on a Tuesday, that she pressed her fingers against the fabric hidden inside her jacket lining. The unit patch was small, maybe 2 inches across, embroidered in muted colors on faded tan canvas. Captain's insignia. A call sign, *Valkyrie*, stitched in white letters. It had been sewn into the lining of her jacket by someone in a Phi base 8 years ago, a night that officially never happened, a mission that had been scrubbed from every database, redacted from every official record. This was the only proof. Fabric and thread. A ghost of a woman who no longer existed. Her fingers traced the patch. Once. Twice. She pressed until her fingertips hurt against the thread. Her breathing came shallow and sharp. 15 seconds. That was how long she let herself sit with it. 15 seconds in a supply closet where no one could see her hands tremble, not from fear. From restraint. From the effort of keeping something caged that had been trained to hunt. Then she locked it down. Smoothed her scrubs. Folded her empty lunch container. Stood and returned to the unit, where her name was being systematically erased, one forged document at a time. The documentation campaign continued its inexorable march. Pierce was building something, she understood. Not an argument. Not a simple termination. A case. Something that would hold up to scrutiny, that would survive any complaint she filed, that would make her look unstable for even contesting it. He was constructing a reality in which she was incompetent, dishonest, and dangerous. By the second week, Margaret, her supervisor, stopped defending her at all. A patient complained about wait time for pain medication. The chart showed it had been ordered 8 minutes before Natalie administered it. Pierce's incident report said she delayed it deliberately, possibly to make the patient suffer. A witness statement from a CNA corroborated this. Natalie had not made the patient suffer. The CNA had been in the bathroom when the medication was ordered. But the statement was there, signed, dated, and filed. The system was designed to be exactly this. It was designed to make truth irrelevant and proof impossible. It was designed by someone who understood that if you document something official enough, if you repeat it enough times, if you get enough people to nod in agreement, then the original truth simply ceased to matter. The patient in room 347 watched her with the eyes of someone trying to remember something he couldn't quite grasp, a tattoo on his forearm that read *N Hayes* in block letters, placed there by someone in a phi base in Bagram 8 years ago, someone who dragged him across 200 meters of kill zone while directing close air support, someone his traumatic brain injury had completely erased from his memory. He would die if she lost her license. He would crash in this hospital and there would be no one to catch him because she was a ghost, and ghosts couldn't save anyone, not without someone noticing, not without someone building a file thick enough to bury her. The Thursday night shift began like every other shift. Natalie was assigned to 4 post-op patients, all of them stable, all of them routine. She would make no decisions. She would make no interventions. She would chart their medications and their vitals and their pain levels, and Dr. Pierce would review her documentation for errors, real or fabricated, and the file would grow. She did not know, standing at the medication cart at 02 for 7 hours, that in exactly 31 minutes she would save a man's life in a way that would be completely unauthorized, clinically impossible, and absolutely necessary. She did not know that this was what he'd been waiting for. That this was the moment he needed. The monitor alarm in room 347 began its 3-tone scream at 02 for 8 hours. The monitor alarm in room 347 screamed its 3-tone warning at 02 for 8 hours, and Natalie moved before sound registered as conscious thought. Her feet were already crossing the threshold before the first nurse at the station looked up from her charting, muscle memory older than her nursing license taking over, older than St. Michael's, older than Norfolk itself. The SEAL lay motionless beneath the overhead lights. His chest heaved once, wrong angle, collapsing inward like a sinkhole. The chest tube, the plastic catheter that had been draining blood from his left pleural space since the training accident 3 days ago, hung loose against his ribs, dislodged, useless, the end of it swinging like a severed nerve. She didn't call for Pierce. She didn't call for help. She assessed in 2 seconds flat, breath sounds absent on the left, trachea deviating rightward, neck veins distended like purple cords, O2 sat 68 and falling, heart rate 147, BP 82 over 54 and dropping. Tension pneumothorax. His lung had collapsed completely, and every breath he took was pushing air into the pleural space, compressing his heart, suffocating him from the inside out. The room had maybe 4 minutes before his heart stopped. She was already moving toward the crash cart, her fingers finding the scalpel before her eyes registered which drawer. The blade was cold beneath her palm, exactly the weight she remembered, the curve of it fitting her hand like a key in a lock. 14 years since Bagram. 14 years since she'd held a scalpel like a weapon instead of a medical instrument. 14 years since she'd cut through skin and muscle and intercostal fascia while mortars fell like rain on a phi base that didn't exist on any map. "What are you doing?" Pierce's voice came from the doorway, thin and high, his clipboard pressed against his chest like armor. She didn't answer. She didn't have time to answer. The SEAL's breathing had turned to gasping, a fish drowning in air, his body's reflexes screaming for oxygen it couldn't access. She swabbed the second intercostal space with an alcohol prep pad, muscle memory, clinical training merging with something deeper, and her hands moved with the terrifying fluid precision of someone who had done this before when the alternative was watching a man die. The blade went in at the midclavicular line. The resistance lasted maybe half a second before the tissues gave way, before she was through skin and fat and muscle, opening a window into the pneumothorax, all the trapped air hissing out like a sigh. The sound of it, that wet exhalation, that rush of pressure releasing, was a sound she hadn't heard in 14 years and heard every night in her sleep. "Stop! That's unauthorized." Pierce took a step forward, then stopped, frozen, his clipboard clutched like it could protect him from what he was witnessing. She wasn't listening. She was watching the SEAL's chest expand properly for the first time in 4 minutes, watching his face lose that suffocating gray pallor, watching oxygen saturation climb the monitor like a ladder, 68, 72, 76, 81, 87. She was listening to the lung re-expand, the wet crackle of air moving through tissue that had been compressed into uselessness. His heart rate dropped from 147 to 128. His BP began to creep upward, 85, now 88, now 91. Sinus rhythm. Regular. Perfusing. She stepped back from the bed. Her hands weren't trembling. Her breathing was steady, controlled, measured. She'd learned control in a place where trembling meant you died and took your team with you. Get me a 14-gauge angiocath needle. We need a tube thoracostomy before this reaccumulates. Her voice was different now, not asking but issuing an order, the kind of voice that made people move before they thought to question it. The trauma nurse from night shift appeared beside her holding the catheter kit, eyes wide but compliant. Pierce still stood in the doorway like a statue, like someone whose blueprint for reality had just been redrawn in front of him. His mouth opened. Closed. Opened again. I'm calling. The surgery team. Natalie was already positioning the needle at the fourth intercostal space, anterior axillary line, the anatomical landmarks appearing beneath her fingers like coordinates she'd memorized in another life. Call respiratory. Call blood bank. We need 6 units standing by. She inserted the catheter with the practiced efficiency of someone for whom this had once been routine. The rush of air confirmed what the monitor already knew: the lung was recollapsing, the seal's body actively fighting to kill itself. But the tube was in now, the catheter secured, the pleural space draining blood and air into a water seal chamber that would prevent backflow. The O2 sat climbed again, 74, 81, 89, 94. Call Psycho for a bed. She was already stripping off her gloves, already moving toward the door, already becoming invisible again. He'll need chest imaging, probably a CT of the thorax, and someone needs to figure out why that tube dislodged in the first place. The SEAL's eyes were open now, confused, his brain starting to register that he could breathe again. He looked at her, not recognizing her, never recognizing her, the traumatic brain injury having stolen the night she'd carried him across 200 meters of kill zone, stolen the moment she'd dragged him through a phi base that was collapsing around them like a house made of cards, and his lips moved soundlessly. She didn't pause. She didn't meet his eyes. She was already past Pierce, already washing her hands at the sink in the hallway, the antiseptic foam white like foam on a river nobody else could see. That night, 37 minutes later, Dr. Pierce filed his incident report. The document was precise, meticulous, the language clinical and damning. Unauthorized invasive procedure performed without attending physician oversight. Use of non-sterile technique. Deviation from standard protocol that endangered patient care. He included witness statements from staff members who hadn't even been in the room. The trauma nurse would later swear under oath that she'd never written them, and he attached photographs of the emergency supplies in disarray, evidence of chaos, evidence of someone operating outside her scope. But the SEAL lived. That was the problem. The SEAL lived with a functioning lung and stable vitals and a clear chest X-ray at 0800 hours, and all of Pierce's carefully constructed documentation couldn't change that simple, stubborn fact. He could write violations and cite protocols. He could have her security clearance reviewed and her nursing license examined by the state board. He could build a mountain of regulatory violation so high that even the best defense attorney in Norfolk couldn't climb it. But the SEAL had her name tattooed in block letters down his forearm, even if he didn't remember where it came from, even if the traumatic brain injury had erased the context that made the tattoo sacred. And in a hospital where everyone was watching everyone else, waiting for the moment of redemption or catastrophe, they'd all seen her hands move with surgical precision while Dr. Pierce stood frozen in a doorway, clutching a clipboard like a child clutching a stuffed animal. She didn't know, as she sat at the nurse's station 2 hours later, watching the SEAL's monitor from a distance, that the ticking clock had just accelerated. She didn't know that Pierce was already on his phone, already calling the hospital administrator, already accelerating his timeline from 72 hours to 24. She didn't know that by the end of this shift, by the moment the sun touched the horizon over Norfolk, there would be a formal disciplinary meeting waiting for her, with HR and lawyers and a termination letter already typed and ready to sign. What she knew was this: the SEAL was alive. The SEAL would walk out of St. Michael's in another 72 hours, would return to whatever life Navy SEAL Captain Marcus Halloway had waiting for him, would never know that the quiet woman with calloused hands had cut him open twice, once in a place that didn't exist on any official map, and once in a hospital room on a Tuesday night when the whole world was asleep. She touched the faded unit patch sewn inside her jacket lining, her fingers tracing the edge of it through the fabric, and her jaw tightened to stone. That was the last peaceful moment Natalie Hayes would know at St. Michael's. Within 1 hour of the thoracotomy, Dr. Pierce sat at his desk with the incident report already drafted. His fingers moved across the keyboard with surgical precision, not the precision of a healer, but the precision of a man who had spent 23 years learning how to weaponize bureaucracy. Unauthorized invasive procedure, he typed. Use of non-sterile technique. Failure to maintain scope of practice. Each phrase was a stone, carefully placed, building a wall that would be impossible to climb out of. He attached the fabricated witness statements, nurses he'd personally coached during their break, reminding them what their paychecks depended on, reminding them how quickly union protections could be challenged if someone filed the right complaints about their own charting. Medication errors that never happened. A pattern of insubordination. He even included a note about her concerning tendency to exceed her authority, phrased in a kind of administrative language that sounded reasonable until he realized it was a noose disguised as a memo. By 8:08 a.m. Thursday morning, the termination meeting had been scheduled. A windowless conference room on the 3rd floor. HR representative Janet Kovac across the table from Natalie, her expression carefully neutral, the kind of face you develop after firing 47 people in 9 years. The manila folder in front of her was an inch thick. Natalie sat with her hands flat on the table, palms down, her posture the same as it would be in a boardroom briefing before a classified operation. She did not fidget. She did not blink at the recitation of charges that bore no resemblance to anything she had done. Captain, Kovac caught herself. Ms. Hayes. This is your notice of termination, effective immediately. The hospital has documented a pattern of concerning behavior including unauthorized procedures, medication errors, and repeated insubordination toward your supervising physician. The fluorescent lights hummed overhead like insects trapped in plastic. Natalie's jaw was a line of granite. Dr. Pierce filed this incident report at 1:14 a.m. after the emergency in room 347. He indicates that you performed a surgical procedure without authorization, used non-sterile technique, and acted outside your scope of practice as a registered nurse. Natalie said nothing. Additionally, we have documentation of medication errors dating back 6 weeks, failure to follow chain of command protocols, and a documented pattern of disrespecting physician authority. Kovac opened the folder. There are witness statements from 3 nurses corroborating. From 3 nurses Dr. Pierce personally spoke to in the break room between 11 p.m. and midnight Tuesday, Natalie said quietly. Her voice did not waver. It did not plead. It simply stated fact. I was in room 347 stabilizing a patient. I was not in the break room. Kovac's pen paused. For a moment, something flickered across her face, a recognition of the problem with her script. Then she continued reading, because the script had already been approved by administration, and administration had already been assured by Dr. Pierce that this was all completely justified. The hospital cannot continue employing someone who demonstrates this level of disregard for professional standards and physician authority. Kovac closed the folder. Security will escort you to your locker to collect your personal items. Your badge access will be revoked immediately. Your final paycheck will be mailed to your address on file. Natalie stood. She did not argue. She did not cry. She did not ask questions about the false statements or offer her version of events, because she understood that the outcome had been predetermined the moment Dr. Pierce decided she was a problem that could be solved with enough paperwork. The walk to the locker room felt longer than it should have. Security walked 3 steps behind her, a formality that was supposed to look professional and felt like an escort from a prison. Natalie's locker was in the break room where the other nurses had stopped eating lunch the moment she sat down. The room was empty now. It was 9:11 a.m. on a Thursday. Everyone was working. She opened the locker, the one with her name in permanent marker on a strip of tape, and began removing the pieces of her civilian identity. The cracked world's best nurse mug that her sister had given her 6 years ago. A wilted succulent that had somehow survived 5 months without proper sunlight. At the bottom, wrapped in a paper towel, the photograph of her spotter from Bagram. Specialist James Chen, call sign Ghost. 24 years old. Dead for 8 years. The photograph was water-stained at the edges, the colors fading, his face becoming abstract. She tucked it beneath the other items, pressed it down gently, covered it with her jacket. The cardboard box from the supply closet felt too small and too heavy at the same time. She turned to walk out, and that's when she saw Dr. Pierce watching from his office window on the second floor overlooking the main corridor. His reflection was visible in the glass, satisfied. Smug. The kind of expression that comes from winning something that was never actually a competition. She did not wave. She did not acknowledge him. She simply walked past the security guard and out of St. Michael's into the Norfolk morning. Rain came that evening and did not stop for 3 days. By Saturday afternoon, Natalie stood at the bus stop on Granby Street with the cardboard box balanced on her hip like a child. Water soaked through her jacket in dark patches. Her hair was plastered to her face, and she did not brush it back. The rain hammered the shelter glass with the sound of distant gunfire, and she stood motionless, watching the street. The photograph of Ghost had curled at the edges from moisture. His name was fading. Soon it would be illegible. Soon there would be no proof he had existed either, except in the memory of someone who was officially supposed to forget. The Pentagon had ordered her to disappear 8 years ago. They had scrubbed the Bagram operation from every record, removed her name from the official reports, classified her medals into vaults she could never access. Captain Natalie Hayes had ceased to exist the moment the last helicopter lifted off Forward Operating Base Chapman on November 12, 2015. The operation that had made her a legend, the one where she'd carried 3 bleeding operators 400 meters through a kill zone while calling in close air support that neutralized 14 enemy combatants, had been sacrificed for diplomatic convenience. Some missions were too effective. Some victories created the wrong kind of political problems. So they had erased her instead. Now she was just a nurse. A terminated nurse. A woman with a cardboard box and minimum wage job applications that would never lead anywhere because she couldn't explain the 8-year gap in her employment history. The studio apartment she'd been saving for would stay out of reach. The normalcy she'd been promised when they discharged her from active duty would remain a lie. A car passed through a puddle at the curb, splashing her legs with dirty water. She did not flinch. The bus was running 11 minutes behind schedule. Inside the cardboard box, the succulent's last leaf was browning, curled at the edges like the photograph, like everything was slowly returning to dust. She stood in the rain and waited for transportation that would take her to an apartment that wasn't hers yet and a future that had already been decided by people who had never met her. This is what buried looked like. 3 days later, at 4:23 p.m. on Tuesday afternoon, an Afghan patient arrived at St. Michael's emergency department by ambulance. Shrapnel wound to the left flank, penetrating trauma, signs of infection in the wound tract. 34-year-old male, granted asylum status through State Department channels 18 months ago. The intake form noted he was a former Taliban combatant, which meant every emergency room staff member in the hospital suddenly had an interest in his paperwork. Natalie had returned to St. Michael's only to collect her final paycheck from HR, the one that was supposed to be mailed but which she decided to retrieve in person, because sitting in her apartment waiting for mail felt like admitting defeat. She was in the waiting area near the administrative offices, processing the final indignity of human resources, when the patient was wheeled past on a trauma stretcher. He was conscious. His eyes were scanning the faces of the staff members around him with the hypervigilance of someone who had spent years learning to recognize threats in crowds. Then his gaze locked on Natalie's face. His pupils dilated. His breathing changed. His hand reached out toward her like a man drowning, and he whispered one word in Pashto, then English, his accent thick as sand, Valkyrie. The silence in the waiting area lasted exactly 3 seconds. Then his hand fell back to his side, and the paramedics continued wheeling him toward Trauma Bay 2, but the damage was already done. The word hung in the air like a prayer and a curse and a classified document suddenly made manifest in the real world. The Marine Corps liaison reviewing his intake file for security clearance was standing 15 feet away. His pen stopped moving. His eyes went to Natalie, then back to the patient, then to the intake form, then back to Natalie. She was wearing civilian clothes, jeans and a jacket soaked from 3 days of Norfolk rain, no hospital badge, no credentials. But the recognition in the Afghan man's face had been unmistakable. The liaison pulled his phone and walked into a back office. Natalie heard him say, "I need to speak with someone at NCIS. We may have a security incident." Then he said her name. Not her civilian name. Her rank and her last name. The one that had been classified 8 years ago. Captain Natalie Hayes. Former Navy. There's an identification situation here that needs immediate escalation. Within 90 minutes, a staff car with Marine Corps insignia on the license plates pulled into the St. Michael's parking lot. A lieutenant colonel stepped out, his uniform immaculate, his bearing military enough to make everyone in the hallway straighten their posture as he passed. He walked directly to the administrator's conference room, where Natalie had been escorted by security, different security this time, with different instructions and different deference. The lieutenant colonel entered carrying a tablet. He entered a code. The screen illuminated with the classified header that every soldier recognized. His eyes met Natalie's for one steady moment. Then he began reading, "For extraordinary heroism under fire at Forward Operating Base Chapman, Bagram Province. Captain Natalie Hayes carries 3 wounded operators across 400 meters of hostile terrain while directing close air support. Captain Natalie Hayes sustained multiple shrapnel wounds during the extraction and continued treatment of personnel under active fire. Captain Natalie Hayes' actions prevented an estimated cascade failure that would have cost the lives of an additional 4 personnel under her direct care." The general's voice didn't waver as he read. Each sentence landed like a physical blow, not to Natalie, but to everyone watching. The conference room had gone absolutely silent. Even the fluorescent lights seemed to hold their breath. Dr. Pierce stood in the doorway, his face draining of color with each word. His mouth opened. Closed. Opened again like a fish pulled from water, searching for oxygen that wasn't there. That's from an August 2015 classified citation, the Marine Corps liaison continued, lowering the document. Declassified 48 hours ago by the Joint Chiefs of Staff. He looked at Pierce. "You fired a Navy Cross recipient for performing emergency medical intervention. You fabricated documentation to justify the termination. You attempted to obstruct a federal investigation into medical supply fraud by altering her personnel file." Pierce's voice came out strangled. "I don't know what this is hospital business. She doesn't belong here. She was terminated for cause." The general didn't let him finish. A 2-star general commanding attention in a space meant for administrators and middle management. His uniform carried decorations Pierce would never earn, authority that couldn't be questioned or negotiated. "Dr. Pierce, you're under investigation for insurance fraud, falsification of federal records, and obstruction of justice. FBI agents are currently securing your office." The word FBI hit the room like concussive force. The hospital administrator's face went gray. The compliance officer beside him stood, already calculating liability exposure. The general gestured toward the door, and 2 federal agents entered with the kind of fluid precision that only came from training most civilians never witnessed. One of them held a manila folder. "Dr. Marcus Pierce, we have a warrant to search your office and your residence. We're also executing a subpoena for your communications with Pinnacle Medical Supply, Limited, dating back 36 months. The agent's voice was flat, professional, the tone of someone who delivered this speech 100 times. "You have the right to remain silent." "This is absurd," Pierce said, but his eyes had gone glassy. His hands trembled. "I want my attorney. I'm not saying anything else without." "Understood," the agent said. "Let's go." They walked him out of the conference room. The agents flanked him like bookends, one on each arm, not quite touching but close enough that resistance would be immediately apparent. They didn't hurry. They didn't drag. They walked him down the hallway with the measured pace of men who'd done this hundreds of times, and the timing was perfect, 3:41 p.m., exactly at shift change when the ICU was rotating staff. The nurses' station had a full audience. Every nurse who'd abandoned Natalie in the break room stood frozen. The pharmacy tech who'd filed the false complaint. The unit secretary who'd spread rumors. The resident who'd whispered to interns about her inappropriate scope creep. They watched in absolute silence as Dr. Marcus Pierce was walked past them, his face crimson now, not pale, rage and humiliation fighting for dominance in his expression. "You're making a mistake," Pierce said to no one, his voice rising. "I have connections, I know people in the state health department, my attorney is." "Your attorney will meet you at the field office," one agent said quietly. His badge clattered against the tile as they passed. The sound of it echoed down the corridor like punctuation. Natalie stood beside the general, watching the nurses' faces. She didn't smile. She didn't acknowledge their sudden realization that they'd backed the wrong horse. She simply watched with the calm of someone who'd already survived far worse than professional embarrassment. The second agent was already at Pierce's office with a federal warrant, photographing the space before opening his files. Everything was being documented. Every computer seized. Every file box logged. The hospital's legal team would later discover that Pierce's kickback arrangement with Pinnacle Medical Supply had cost the institution nearly $847,000 in fraudulent billing over 3 years. Unnecessary equipment. Inflated prices. Equipment ordered and billed but never delivered, with forged signatures on receiving documents. The pharmacy tech, confronted by a federal investigator with a detailed timeline of when she'd filed her false complaint against Natalie and when Pierce had allegedly pressured her to do it, suddenly remembered things differently. Under oath, the truth emerged. She'd been terrified of losing her job. Pierce had intimated that anyone who didn't support his decisions might be let go. She produced an email he'd sent her. "Need another complaint filed against Hayes. Make it about medication handling. It needs to be credible." The nurse's witness statements fell apart under FBI questioning. The HR director produced internal emails showing Pierce had ordered documentation fabricated. Not suggested. Not hinted at. Ordered. "Get me 3 more write-ups for Hayes. Patient safety concerns. I don't care if they're real. I need a paper trail." The compliance officer who'd been too afraid to push back admitted everything. The whole structure of Natalie's termination unraveled in 48 hours like a sweater with a single pulled thread. In room 347, the Navy SEAL with *N Hayes* tattooed on his forearm watched the commotion with the confused detachment of someone whose memories hadn't fully returned. A Navy psychiatrist had arrived that morning, not to treat him, but to try to reconstruct his traumatic brain injury through guided recall. She held a photograph of Captain Hayes in desert camouflage, standing in front of a Chinook with a weapon slung across her chest. "Do you recognize her?" the psychiatrist asked gently. The SEAL's eyes went wide. Not from the photograph itself, but from something deeper, a cellular memory that his damaged brain couldn't quite articulate. His hand moved to his forearm, to the ink spelling out *N Hayes*, and something flickered behind his eyes. Recognition. Pain. Gratitude. All of it tangled together in the wreckage of his neural pathways. The general personally escorted Natalie through the ICU corridors to collect the belongings she'd already removed from her locker. The cardboard box. The wilted succulent was still alive, somehow, its leaves translucent green. The water-stained photograph of her lost spotter from Bagram, tucked beneath. The *World's Best Nurse* mug that hadn't been ironic when it was given to her, and wasn't now. Nearby, federal agents were photographing Pierce's office. Every file. Every hard drive. Every sticky note with a doctor's illegible scrawl became potential evidence. The hospital administrator signed suspension paperwork while his legal counsel watched from the corner, already calculating the settlement amount this would eventually require. By 6 p.m. that evening, Dr. Pierce's medical license was suspended pending investigation. By the following Tuesday, the state medical board opened a formal ethics investigation. By Thursday, his wife filed for divorce through counsel. By Friday morning, his children's expensive prep school tuition was in question, and his financial advisor was returning calls about asset preservation. The hospital posted a notice on the ICU bulletin board at midnight. When no one was watching, Dr. Marcus Pierce has been placed on immediate suspension. All personnel actions initiated by Dr. Pierce in the past 12 months will be reviewed. Any employee who believes they were subjected to retaliation or unfair termination based on Dr. Pierce's directives should contact HR immediately. The implications were impossible to miss. That night, Natalie sat in her apartment, a sparse studio with second-hand furniture and no photographs on the walls, and received a message from the general: report to Walter Reed tomorrow, 0800 hours. New assignment briefing. Bring dress blues. 6 months later, someone sent her a photograph. It arrived in an unmarked envelope, no return address, just a single image. Dr. Marcus Pierce in a community college classroom, demonstrating chest compressions on a plastic CPR dummy. His movements were stiff, uncertain. His face was lined and gray. His shirt was a polo with a community college logo embroidered on the chest. The caption on the back, written in careful block letters, heard he needed work. Thought you'd like to know where he landed. The photograph was unsigned. She would never know who sent it. Natalie looked at it once, filed it in a drawer, and moved on. Justice didn't require her attention. Her attention belonged elsewhere now. 6 months after Pierce was led away in handcuffs, Captain Natalie Hayes stood at the Pentagon in full dress blues, the uniform she hadn't worn in 8 years, the rank she'd been ordered to hide, the identity she'd been forced to bury. The Secretary of the Navy was pinning the Navy Cross to her chest, and for the first time since receiving her orders to disappear, she stood perfectly still and let herself be seen. The citation was read aloud, no longer classified, no longer scrubbed from the record. Captain Natalie Hayes. Navy Cross. For extraordinary heroism under fire. For refusing to abandon wounded personnel. For carrying operators across 400 meters of hostile terrain under active enemy fire. For saving lives that official records said she never touched. The room was full of admirals and operators. Senior medical personnel who'd worked with her husband when he was alive, though she'd never mentioned it. Men and women who'd served in Bagram and knew the name Valkyrie from whispered stories, myth-level references to someone who'd supposedly died in 2015. The Navy SEAL from room 347 stood in the audience, his memory partially restored by months of psychiatric therapy. Not complete, the traumatic brain injury had left permanent gaps, but enough. He remembered hands pulling him through smoke. He remembered a voice saying, "Stay with me in the dark." He remembered why he'd carved her name into his skin. When the ceremony ended, he approached her. She recognized him immediately, even though he was walking without the leg brace now, even though he was alive and breathing and upright in a way that no one had predicted when his lung collapsed. "Thank you," he said. The words were simple. Inadequate. Everything. For carrying me. Both times. She met his eyes. Her voice, when she spoke, carried the weight of 8 years of silence. "Stay strong, petty officer." It was an order. A promise. A prayer. The general handed her reassignment orders that afternoon, chief nursing officer at the new Walter Reed Trauma Center, with a mandate to train the next generation of combat medical personnel in austere environments. Real medicine. Real training. Real authority, finally legitimate, finally visible, finally acknowledged. She accepted with a salute, her hand finally steady enough to hold it without trembling. Back at St. Michael's Hospital in Norfolk, the new ICU director posted a photograph in the break room where Natalie had once sat alone while nurses abandoned their lunches and left without speaking to her. The photograph showed Captain Natalie Hayes receiving the Navy Cross, her dress blues immaculate, the decoration hanging bright against her chest. The caption beneath read, "Our colleague. Our hero." The nurses who'd shunned her would spend the rest of their careers understanding what they'd missed. The unit patch was sewn back onto her dress uniform where it belonged, and the photograph of her lost spotter from Bagram was framed on her new office desk at Walter Reed, no longer hidden, no longer water-stained by tears she'd refused to let fall in public. The quietest person in the room might be holding it all together. If you're watching this, chances are good that you've been underestimated by someone who didn't know your value. Someone who mistook quietness for weakness. Someone who picked a fight with the wrong person. Like this video, subscribe to the channel and hit the notification bell so you never miss a story like Natalie's, because the most powerful people in the world rarely announce themselves. And comment below, what would you have done if you held a secret that could change everything? Let me know. Thank you for watching.